What exactly is an allergic rhinitis, if I may ask you, and if you have to explain it to a 7-year-old?
Runny nose, sneezing. When you get up in the morning, you will have nasal blockage.
Acha.
There is a redness of eyes, itching in the eyes. You'll feel heaviness.
Is just a seasonal problem. Truth or false?
False.
Children outgrow allergies completely. How accurate is this? Actually, how accurate is this?
Not in all patients actually. I would say some children, they when they become old, when they become adult actually, so
Teenagers or grow up.
so from juvenile age group to adulthood, some patient will develop this allergy problem in the later part of life also.
Today, we are discussing a condition that many people dismiss as a simple cold, but in reality, it can significantly impact quality of life. Allergic rhinitis. From persistent nasal blockage and sneezing to poor sleep and reduced productivity, its effects often goes underestimated, especially in urban environments. To help us understand this in more depth, we are joined by Dr. Rahul Magar, consultant ENT head and neck surgeon at Sahyadri Hospital, Pune. With nearly a decade of clinical experience, known for his structured diagnostic approach and comprehensive management of ENT conditions. He was trained at St. John's Medical College Hospital, Bengaluru, and has an extensive experience across outpatient, inpatient, and critical care settings. He has also played a key role in managing ENT complications during the COVID 19 pandemic and mucormycosis outbreak, and it is widely recognized for his clinical precisions and patient centric care. Hello and welcome to Sahyadri Health Talks. This is Dr. Tushita, and today we have with us Dr. Rahul Magar. Hello, sir. How are you?
Hello, I'm good, thank you. How are
Welcome
you?
on Sahyadri Health Talks. I am doing absolutely fine. So, welcome on Sahyadri Health Talks, and it has been a long pending discussion with
Yes.
you. So, we will talk about allergic rhinitis today.
Yes.
So, before I get into the crux of it, right? So, what exactly is an allergic rhinitis, if I may ask you, and if you have to explain it to a 7-year-old?
Okay. So basically, allergic rhinitis, it occurs when your immunity is low. So
Acha.
what are the symptoms of allergic rhinitis? I will not go into definition of allergic rhinitis,
Yeah.
but yeah, what are the symptoms? The symptoms are like runny nose, sneezing. When you get up in the morning, you will have nasal blockage.
Acha.
There is a redness of eyes, itching in the eyes. You'll feel heaviness over the cheeks and itching sensation. So these are the basic symptoms of the allergic rhinitis.
Okay. So, is it very prevalent in certain age group, or do we see it across different age groups?
So we see these symptoms in all age groups actually. So recently I had one patient who was 60, 61 years old, and he said ki few years back I was fine till uh, almost enter my life I was fine, but now all of a sudden these symptoms have developed. So it can occur at any age group.
So we frequently hear this word these days, allergic rhinitis, or for that matter, allergy related conditions. So how significant is this problem in today's day? So how many? So if I have to put it in a proper way, I would ask you, okay, in a month, how many cases of allergic rhinitis do you see?
Okay, so rather than mentioning in 1 month, I would say ki if I'm seeing 10 patients in
Acha.
few hours, like if I have
In
10 patients,
Yeah.
so in among 10 patients, 4 patients of allergic rhinitis will be there.
Okay.
Yeah, so it is very common nowadays,
Mm-hmm.
and this problem has occurred because of the fact, urbanization and a lot of construction is happening all around. So if we are staying right now, we are shooting in Kothur. So if you see Kothur area, everywhere you can see the redevelopment,
Yes.
and all these construction sites are there.
Yes, yes.
So
Actually, I was coming to that.
okay.
The cases are rising.
Yes.
So, what is it that it's driving this trend of increased incidences for allergic
See, if you see
rhinitis?
20 years back, so that time the problem was only pollen grains and few dust mites. But in last 20 years, we are seeing so many changes.
Mm-hmm.
So yeah, so I would say ki lifestyle also is one of the contributing factors because of the poor lifestyle.
Mm-hmm.
So stress and anxiety, not directly but indirectly, it causes these problems.
Mm-hmm.
Again, the dust mites, we can say in last 20 years. No, in old days, 20 years, 20, 25 years back, most of the people used to use fan, not air conditioner. Now AC has become so common.
True.
So AC, in AC vents, we can see the dust actually. So these dust mites can cause the allergic problem. So yeah, I would say dust mites, construction site, pollen, I mean allergens. Then the pollen grains. There are millions of pollen grains across, everywhere actually. I would say.
True.
Then there are food allergens. So there are so many allergens, across atmosphere.
Correct. So, as you said, right, that the typical symptoms which patient comes presents with is sneezing, runny nose, redness of eyes.
Yeah.
But there are certain other conditions also which mimics this. How do I know that I have allergic rhinitis?
So basically, allergic rhinitis is a clinical diagnosis.
Acha.
Yeah. So 80% of the time we diagnose after seeing after getting the history from the patient, and we do the physical examination, and we get to know that this is allergic rhinitis.
So, do we have any specific diagnostic tests for
So
this?
there are few blood tests and skin prick tests are there. So in blood tests we do the immunoglobulin E, and in complete blood count we check the eosinophil levels. So we get to know that our patient is having certain allergies, which is a again immunoglobulin E mediated reaction actually.
So, as you said that it's due to dust mites or pollen grains or certain other allergic elements, right? The triggers which
Yeah.
leads to this. So, if you have to explain it to our audience that exactly what is happening inside your nasal cavity when this allergic rhinitis is happening, मतलब अंदर हो क्या रहा है, क्या चल रहा है physiologically?
So physiologically, if you want to say, so basically I would say in a non-medical language, so whenever you come in contact with the allergens, so I mentioned all these allergens. So whenever you get exposed to these allergens, so there will be hyperactivity of the nasal mucosa, and this hyperactivity of the nasal mucosa, it will lead to the immunoglobulin E mediated hyperactivity reaction actually. So this will trigger the swelling of the mucosa, which will cause the hypertrophy of the terminate, and which will eventually lead to the secretion of the nasal mucosa, and at the end there will be nasal blockage.
How close is this related to asthma and sinusitis in real world patients?
See, there are so many patients who are having allergic rhinitis. They'll end up, having sinus issues and the asthma problems. Yeah, so sinus and allergy. So when there is a patient who is not, who has ignored this allergic problem, so that patient after a certain period of time, after years, can land up into sinusitis and asthma.
So, where do you see these patients typically going wrong before they reach you?
So I would say there are so many patients, they just neglect this problem. So they think कि okay ठीक हो जाएगा, पर ऐसी बात नहीं है. Suppose if you ignore it for longer duration, suppose if you ignore for few years, then persistently what happens, there will be inflammation of the nasal mucosa. There will be this inflammation will cause the hypertrophy of the nasal mucosa. There will be swelling of the nasal mucosa, and mucosa of the septum, and which will cause the nasal blockage. And if you ignore for longer duration, then you might have to go for the nasal surgery, that is septoplasty, or the
Acha, it goes to
submucosal
that level as
resection,
well.
if you ignore this for longer duration, just because of the nasal blockage.
So now let's try to understand the treatment aspect of it. Okay, so like any other condition, there is a conservative management, there is a surgical management.
Yes.
So in the conservative management, some part of it also depends on the steroids, right?
Yes.
And there's a very common myth which I'm sure you are tired of hearing is कि steroids से dependency हो जाती है.
Yeah.
So what do you have to say about this nasal steroid, long-term use, and dependency, the fear in patients' mind?
See, there are different types of nasal sprays available. So what happens, most of the patients, they take the decongestant sprays, oxymetazoline, xylometazoline. These are the common medications available in any pharmacy, and we call it over the counter drugs actually. So whenever you go to the pharmacy, some patients, they don't go to the doctor, they just directly go to the pharmacy, so they'll get these sprays. But these sprays we can use maximum for 5 days,
Acha.
minimum 3 days, maximum 5 days. And when we overuse it or when
Mhm.
we use it continuously, there is a side effect called as rhinitis medicamentosa.
Acha.
So it will cause the again the hypertrophy of the nasal mucosa,
Mhm.
the turbinate, and patient will require a surgery. Patient
Mhm.
might require a surgery.
Mhm.
So that is a problem.
So, how many cases of allergic rhinitis eventually lands up into a surgery?
See, there are many patients. See, not necessarily all the patients will land up. So suppose each of us have, each of us has a deviated nasal septum. In
Yeah.
line of not all the patients, yeah, but some patient will be they will have more deviated nasal septum
Mhm.
from the birth, and such patients will be fine till particular age group. But
Mhm.
when this allergic problem occurs, there will be
Mhm.
inflammation. Again, there will be hypertrophy of the nasal mucosa and the inferior turbinate, and this patient land up in the surgery
Into a
actually.
surgical
Yeah.
management. So while we see some patients who eventually with the treatment, right, their symptoms get milder,
Mm.
they're better controlled, but we still see some patients with during the treatment also the symptoms are still severe, still
Mm.
persistent. So what are the factors that leads to these two variations of outcomes of a treatment?
Yeah. See, now I would differentiate into mild, moderate, and severe
Mm-hmm.
category. So, if patient is having mild and moderate symptoms, so we can control with the, as I said, steroid sprays actually. So, I wanted to tell all the patients and all the people actually, see, inhalation nasal sprays are not harmful. They can be used for longer duration. So usually when the problem happens because patient has misinformation, they do googling, they do chat gpt, and they get the
They do
wrong
everything without
information.
they
Yeah.
do everything apart from coming to you.
See, when you take the tablets or the injections of steroids, then it is harmful. But inhalational nasal sprays, we can give up to 6 months, and
Acha.
it will not cause any problem
Mm-hmm.
because the absorption is very less, and they are quite. These steroid sprays are quite effective. They are very safe, and they are the cornerstone of treatment actually.
True,
Yeah.
true.
So steroid sprays we can give for the mild and the moderate symptoms.
Hmm.
Again, there is the nasal douching. We say, there is a salt, नमक का पानी होता है, so we ask patient to clean the nose. So उससे भी 40-50% राहत मिल जाती है patient को
Acha.
nasal wash से. So nasal wash, steroid sprays are very important.
Very important.
If patients are not relieved by all this basic medical management,
Mm-hmm.
then we can go for a skin prick test. So that is the
Acha.
gold standard nowadays everywhere used.
Acha.
So few years back they used to say कि blood test करवाना है, लेकिन blood test से ज़्यादा effective skin prick test है.
Mm-hmm. Mm-hmm.
And in skin prick test nowadays we check over 200 allergens, so
Yes.
everything is covered. Dust
Yes.
mites, pollen grains, all the food allergens जो भी हम किचन में बनाते हैं सब वहाँ पे कवर होता है.
Mm-hmm.
Then there are pets,
Mm-hmm.
all the animals. There are so many allergens are there.
Mm-hmm.
So we've tried to find out patient is allergic to what allergen, and
Mm-hmm.
हमको जब पता चलता है कि इस चीज से एलर्जी है, so at the end we can go for the immunotherapy. So immunotherapy is quite effective nowadays, and immunotherapy is recommended when patient is not relieved by medical management. It
Acha.
is not cured by medical management. Then last option is immunotherapy.
Acha.
Yes.
So, as you mentioned about that, due to
Mm.
urbanization, the incidences are quite high. So, Pune is developing very fast. Okay, so for that matter, if you just go on this building's terrace, you will see at least 5 to 6 cranes around. So, that's the level of construction that's
Yeah.
happening. So, what are the common triggers which people often overlook or miss out in
Mm.
such urbanization setups?
See, basically now this urbanization, when we talk about urbanization, so all the metro cities basically,
Hmm.
like Mumbai, Delhi, Pune, Hyderabad. So construction is going on everywhere. Now suppose there are so many IT companies in Pune, so
Hmm.
I see so many people coming from, basically we see the floating crowd actually.
Yes, the
So
floating
people
crowd.
from North India or East India, they come to Pune. I
Yeah,
have seen
yeah.
so many young people and the mid-age crowd, they'll have these
Yes.
problems actually. And
Yes.
I would say because of the dust mites and the construction at the construction site, these allergens will be there and they'll
Uh-huh.
suffer. So
Uh-huh.
basically I would recommend these people to wear masks and
Uh-huh.
to avoid and to keep the room clean.
Uh-huh.
So we have to get rid of all these things actually.
Mm-hmm. So can we permanently cure this? Or is it just
Mm,
that, we have to like live with it?
no, see I would say this can't be cured,
Mm-hmm.
and it's not necessary that we have to live with forever.
Mm-hmm.
Yeah. So basically, along with the medical management, we have to improve our immunity.
अच्छा.
Yeah. So ऐसा नहीं है कि हम immunity बढ़ा के ही ठीक हो गए. So
Mm-hmm.
you need some kind of medical management support, and then we have to increase the immunity.
अच्छा.
Yeah. So it might work well.
So that's about allergic rhinitis. And now moving on to quickly to the next segment of this podcast, where I have some questions, which I want quick answers from you, some mythbusters, so that we can clear those myths once and for all.
Okay,
Yeah.
fine, sure.
So the first one goes: one symptom patients should never ignore when it comes to allergic rhinitis.
Persistent nasal blockage.
Okay.
Yes.
So when you say persistent, right? Like what's the duration or frequency, or what is it?
So at least minimum, 3 to 4 months or 6 months, I would say.
Mm-hmm.
If persistent nasal blockage is there, then you have to go to the doctor and find out what is the reason.
Mm-hmm.
Yeah, because as I told you before, allergic rhinitis, because there will be inflammation of the nasal mucosa, and this hypertrophy of the turbinate or the deviated nasal septum can become a problem. Can become problematic. So
Problematic on
sometimes
long
it can
run.
turn into sinus blockage and the headache. So all those symptoms can happen.
Okay, so persistent nasal blockage, a big red flag.
Yes, yes.
Okay. Most common mistakes patient makes.
When they avoid, suppose they are at home, so they don't clean their, pillows, mattresses, or beddings actually. So at least I think every week, 2 to 3 times we should clean these.
Sure. One hidden trigger people underestimate the most.
So I would say keep patients sleep in that dusty environment actually, and poor hygiene, I would say. Yeah, if it is a rainy season, so there will be fungus on the walls actually. So
Yes.
you have to keep in mind you have to keep your windows open during rainy season.
That
Poor
dampness
ventilation,
and all that
it will
stuff.
dampen the walls, and that moisture, it will cause the fungus, and this fungus is very common nowadays.
Yeah. One daily habit that silently worsens allergies.
Daily habit in the sense, yeah, so as I said before also, this
Basic hygiene.
no, basic hygiene, and this some people have poor habit of carrying this nasal decongester sprays actually.
Acha.
They can, now I have seen so many patients, they carry in their pockets.
Bags.
Yeah. And because what happens, the patient get relief immediately, but they keep using it, and
The over the counter
yeah,
ones which are readily available.
so I'll tell you, 3 to 5 days maximum we should use it.
Masks and air purifiers, helpful or overhyped?
In some way these are helpful, and especially in urban cities.
Acha.
Yeah, so because of the, again I told you, construction sites and all,
As to avoid those kind of allergens.
yeah, so if we see nowadays there is a lot of we'll always talk about the air quality index, AQI.
Yeah.
And Pune's AQI is going down actually. I mean, it is
True.
becoming worse.
Yes. We are in the wrong race.
Yes, actually.
We are in the wrong race. Okay. Allergic rhinitis is just a seasonal problem. Truth or false?
False,
Why?
actually. Yeah. So seasonal means what? See, when season changes, like suppose now we don't, in India we don't have spring and autumn actually.
Yeah.
But still, when from summer to monsoon or monsoon to winter, so that time many patients will have these allergy problems. But there are so many other allergens. There are millions of pollen grains in the atmosphere. These dust mites, in the food allergens. Okay, and also that, if you talk about the room fresheners, room sprays, uh, incense,
The sticks which
yeah,
comes,
those
na?
agarbatti sticks actually.
Yes. Even we have those things, na, which in the liquid they put that stick and it's a room
Yes,
freshener kind of
yeah,
thing.
yes.
So
So again,
these-
it contributes for the allergic problem.
Okay, nasal sprays causes dependency. Fact or myth?
Only the decongestant sprays, not
Okay.
the
Not the
steroid
one which
sprays.
is prescribed by your doctor,
No,
right?
no.
Yeah. It's better to avoid medicines and build immunity naturally.
I answered this question actually. So yeah,
Yes.
we have to build immunity. I always tell my patients to build up the immunity, but you have to start this basic routine medical
management as
so
well.
both things go simultaneously.
Yeah. So one will not succeed without the other.
Yeah. On a longer run, I would say you have to build up immunity. Yeah.
But then medical management is equally important.
Yes, yes,
Okay.
yes.
Children outgrow allergies completely. How accurate is this? Actually, how accurate is this?
Not in all patients actually. I
Mm-hmm.
would say some children, they, when they become old, I mean when they become adult actually, so they,
Teenagers or
yeah,
grow up.
yeah. So from juvenile age group to adulthood, they, some patient will develop this allergy problem in the later part of life also.
True.
Yeah.
Okay. If symptoms are mild, treatment isn't necessary. Agree or disagree?
uh,
Of course, you disagree.
yeah, I disagree because I feel ki if it is the initial stage, you should
Hmm.
immediately go to the doctor. Okay, not
Yeah.
immediately within 2 3 days, but at
Huh.
least few weeks, a month.
Don't wait
Yeah,
for it to get
then don't
worsened.
wait for like 6 months, 1 year, 2 years,
Ah.
and then when you come to doctor, they want you to do some magic. So
Yes.
we are living in a world where magic science is not there, medical science is there.
Yes, yes, true, true.
Yeah.
So that's about allergic rhinitis. And before I let you go, we have a ritual at Sahyadri Health Talks. The
Okay.
ritual is we listen to stories. So
Okay.
share us some patient stories with that you have, which has left a mark in your memory, or some story which has shown good prognosis. Some
Yeah.
patient story.
See, there are so many patients over last 6 7 years I have operated,
Yes.
and there are so many patients actually. So if I have to tell one story, one patient story,
Huh.
the last month only, I'll just tell you the recent story, which patient had allergic rhinitis along, and his nasal septum was straight actually,
Acha.
and he had allergic rhinitis since long time. Patient was from Mumbai.
Mm-hmm.
He was an IT professional, and
Acha.
he had come to Pune for the job actually. But again, he used to he have sedentary lifestyle,
Mm-hmm.
and he was to work in AC.
Hmm.
So because of this, AC exposure, dust mites,
Mm-hmm.
continuous exposure, he had nasal blockage, persistent nasal blockage, and he had runny nose, sneezing, and most importantly, he had snoring and the mouth breathing. So
Ah.
basically, his wife was, actually, she was worried about these symptoms, and her main thing was that she was not able to sleep because of his snoring. Yeah, so they came to my OPD. So yeah, so I diagnosed and patient. So I told him it's not necessary that we have to go for the surgery immediately.
Mm.
We can wait and watch. So I gave them medical management. Yeah, patient was much better, but again, their symptoms are better, but is there any way of going for the surgery? I said your nose is also straight. I did CT scan where
Mm.
the nasal septum was absolutely straight.
Mm.
Yeah, but when I checked this, so on the clinical examination and on the CT scan, there was hypertrophy of the inferior terminate, and it was mainly because of the allergic problem. And one more important thing, patient had taken this nasal decongestion drop almost for 3 4 months.
Oh.
Yeah, so that also contributed for this problem. So yeah, so I use the latest technique which is available everywhere, coagulation, coagulation of the inferior turbinate.
Mm.
So after the surgery, surgery lasted for only like 45 minutes,
Mm-hmm.
and after the surgery, next day immediately, patient was absolutely relieved,
Mm-hmm.
and wife was more happy because his snoring and mouth breathing,
Mm.
and when they came for the follow up after 5 days, so they were telling me, the couple was telling me that मुझे पता ही नहीं था कि आप लोग ऐसे नॉर्मली सांस लेते हो, इस सांस में पिछले 10 साल से नहीं ले रहा हो.
Oh my God.
So it was a quite good story.
Uh-huh.
Yeah,
So
so
now the patient is doing fine and wife is happy,
yeah, both are happy.
getting some peaceful sleep.
Yes, peaceful sleep. Now the husband told me, wife is snoring, but I'm not snoring now, so I don't get sleep because of the wife.
So you might soon see her in your OPD.
Actually, I would say she was pregnant. She was in the 8th month, and because she had baby, and she had put on weight because of the
Yeah,
pregnancy.
yeah, yeah.
Actually,
So I think that phase has its
yeah.
own
So it will get resolved within 6 to 8 months, I
complications.
feel, after the
Yeah,
pregnancy.
yeah, true.
Yeah.
So, any last message for all our viewers out there listening to this podcast?
Yeah. So I would tell all the people, don't use these nasal decongestion drops again and again, because in OPD every day I had to tell two patients, please don't use these drops. Again, these nasal steroid sprays, they are not harmful. They are safe, effective, and we can take up to 6 months because these are inhalational sprays. The absorption is very less. Yeah, and there is a treatment called as skin prick test, allergy test. So when you don't get, when you have these symptoms for longer duration, more than 1 year, so we can always think about this allergy test, skin prick test, and the treatment part is immunotherapy, which is
Mhm.
available everywhere.
Hmm.
Yeah, so yeah, this is what I want to tell all the people who are suffering from the allergic rhinitis.
So that's coming right from the expert. Thank you so much, sir, for coming on Sahyadri Health Talks. Looking forward to have you again with some other topic, or maybe with the new format of the podcast that we have. And thanks a lot once again from the entire crew.
Yes, thank you so much. It's my
Thank,
pleasure.
thank you,
Yes.
sir. Thank you. This is Dr. Trishita signing off. Sahyadri Health Talks.